afternoon, and thank you for joining us today for this the Patient Online Access to Records Awareness session. My name is Ifran Kalsheker, and I'm one of the project managers of the Commissioning Support Unit. Can everyone hear me at the back? Just wanted to check. Fantastic, thank you. Please note that this session is being recorded, and a video will be made available after the event, and that will be posted on our GP-facing website. The clip you just saw was an Eggbot. Eggbot is an animation endorsed by the Department of Health, NHS England, and the National Information Board, and it summarises the ambitions of the NIB's Personalising Health and Care Report 2020, which is when all patient and care records will be digital, accessible in real time, and interoperable. The objective for the session today is to provide pragmatic guidance and support to GP practice teams with the implementation of detailed records access for patients. In your information packs, you should have an evaluation form. I'd be grateful if you could please complete this form before you leave the session today. Here's an outline of the agenda for this afternoon. Dr. Chris Frith from NHS England will talk about the key changes to the 2015 and 16 GMS contract and how it builds on from last year's requirements. He will also cover the implications of detailed records access from a GP perspective in terms of the purpose of patient records and the impact on general practice. We'll then be hearing from our patient representative, Trevor Fossey, who is a member of the patient participation group at his local GP practice. In 2013, he proposed online access to records at his local practice, which came to fruition in January 2014. At 3 p.m, I shall ask delegates from practices using System 1 to transfer to the adjoining suite, which is just behind me, for a live demo of the System Online patient app. Delegates from EMIS practices will remain here in the conference room for the EMIS live demo of patient access mobile application. After that, David Hill from Ireland Gem Commissioning Support Unit will present a short piece on proxy access, and towards the end of the session there will be an opportunity for questions and answers, and the session will draw to a close at 4 p.m. this afternoon. The data I'm about to present this afternoon is from HSCIC's indicator portal. The portal combines hundreds of health indicators, including GP practice level data, which is designed to improve healthcare and support patients in making better informed choices about the practices they can choose to register with. The figures are from a report called Patient Online Trend Analysis, and the report combines HSCIC's electronic access to GP records and patient online management information data. Please note that the March data is missing because the BMJ Informatica information was not available in time for publication. However, the trend data is just as relevant without the March data. You will see that across the 4 CCGs for Derbyshire, out of a total practice population of 1,008,339, the total number of patients enabled, expressed as a percentage of the population registered for online access, is 12.5%. I'm pleased to announce that Derbyshire leads the way nationally for detailed records access. Between February and May 2015, the number of appointments booked online or online transactions increased from 15,260 to 16,504. Based on the data, the total number of appointments booked online increased at a rate of 1,288 patients per month. And as more practices implement detailed records, we expect demand for online services to increase even further. The total number of enabled patients in Derbyshire, that's the total number of patients registered at practices that currently offer detailed records access, between January and April 2015, increased from 116,827 to 126,023, and has been growing steadily with 2,299 patients registering for access each month. Again, we expect this trend to escalate as public and patient awareness of these services increases across local communities. In Northern Derbyshire, out of the total practice population of 267,162, the total number of appointments booked online is currently 39,520. And the total number of repeat prescriptions ordered online is currently 39,215. This is equal to 15% of the total number of patients registered for online services. Thank you very much. I shall now hand you over to Dr. Chris Frith from the Patient Online Programme at NHS England.